excited to share our new collection of materials for strengthening community nutrition programs. As we know, a variety of factors influence maternal, infant, and young child nutrition practices, and support for recommended practices is critical to improving behaviors. IYCN reaches mothers and other caregivers and works to engage key influencers such as men, grandmothers, and community leaders. Involving these key influencers ensures that women and families receive the same messages when they're at home, in the community, and at facilities. It also helps women to feel supported to try and continue recommended practices. We've developed a collection of tools and resources for reaching mothers, families, and communities based on gaps we identified and needs from our country programs. For example, in Kenya, there is considerable emphasis at the national level on the need to engage men in infant and young child feeding. However, there were no tools or guidance on how to do it. We developed a training manual on infant feeding and gender for male group leaders and refined it based on feedback from pilot testing and findings from formative research. Our collection includes literature reviews, training materials, and M&E resources. We conducted global literature reviews on the role and influence of grandmothers and men on maternal, infant, and young child nutrition, as well as a literature review on behavior change interventions and child nutritional status. We developed training materials for peer educators, men's groups, grandmother groups, mother support groups, community leaders, and also developed a guide on how to integrate maternal, infant, and young child nutrition into community theater activities. We adapted existing materials and pulled content from materials from our partners, as well as created new content to meet the needs of our country programs. The training materials contain exercises that build skills and encourage participants to reflect on current practices, share experiences, and develop action plans. The collection also includes M&E forms that have been used extensively in our country programs in Zambia and Cote d'Ivoire. These forms can be adapted to meet the needs of individual programs, and they include a counseling supervision checklist, an exit interview questionnaire, and a referral tracking form and register. This is a picture of Irene. She's a community counselor from the Society for Women in AIDS in Kenya, or SWAC. She's walking with Josephine and her baby, one of many families she supports in Western Province. Irene was one of 400 community volunteers from SWAC who received training on infant and young child feeding and HIV. In Kenya, IYCN collaborated with USAID's AFIA 2 Western program, which was led by Pat. We worked together to integrate infant feeding counseling and support into their existing community-level activities. As part of AFIA, SWAC's community counselors were already conducting home visits, facilitating discussion groups, and organizing community mobilization activities. But they had not received any training on HIV and infant feeding. All of their activities were focused on HIV prevention, care, and support, but without any infant feeding. So although these workers were sharing information and providing support to families, they weren't able to answer questions about how to safely feed their babies. So we thought we had an opportunity to ensure that HIV-positive pregnant women and mothers received the information and support they needed to make infant feeding safer. After some joint work planning, we developed a 2-day training manual and participant materials on infant and young child feeding in the context of HIV. We chose the training content based on formative research findings, as well as discussions with SWAC and AFIA staff. The training focuses on supporting optimal infant feeding practices, referring women to services, and developing action plans to integrate infant and young child feeding into their existing activities. The SWAC volunteers trained on infant and young child feeding went on to reach 34,000 women in their communities. They were able to provide infant feeding messages as well as support to mothers and families. Through this experience, we learned that community-level HIV activities provide an excellent opportunity to support HIV-positive mothers to practice safer infant feeding, especially when they're already providing support to these families anyway. Josephine, who exclusively breastfed her baby, and many other women like her benefited from this collaboration. Through formal and informal observations and assessments in many of our country programs, we found that the quality of health talks given by facility and community-based health workers could be improved. It was not unusual to see health workers reciting long lists of key messages on a variety of different health talks, while women waited for services with no participation. We also found that although individual nutrition counseling is recommended, most women were receiving nutrition information through group sessions or health talks, which further demonstrated the need to strengthen these talks. We developed a training manual for a half-day workshop and conducted this training as part of our demonstration project in Zambia. After the training, infant feeding-focused health talks became more frequent. For example, on average, 4 health talks were facilitated each week at Bwacha Health Center on infant and young child feeding related topics, whereas before there would be 1 health talk a week and it rarely covered infant and young child feeding. During supervision visits following the training, IYCN staff observed a number of improvements. Health workers delivered more specific messages compared to unfocused, generic messages given previously. They utilized new techniques to engage mothers in discussion, including question and answer sessions. And they used visual aids such as counseling cards that help mothers to better understand the content. Community theater can be an effective way to support positive changes in health knowledge and behavior, as well as social norms. We developed a short guide for program planners and theater groups on how and why to integrate maternal, infant, and young child nutrition into their theater activities. This guide is based on IYCN's experience implementing community theater in Zambia through our demonstration project, as well as PAC's experience with using our approach called Magnet Theater, which is a community theater approach. PAC has used Magnet Theater for a variety of public health topics throughout Africa and Asia over the past decade. What makes Magnet Theater unique and particularly effective is that the performance is stopped at a key dramatic moment when a character is forced to make a decision. At this point, the participation begins. Audience members can then advise the character on what he or she should do based on the dilemma, or they can go up and take the place of an actor themselves and act out what they think would be the right thing to do. Following that, there's discussion around these decisions and what people should do. This guide includes suggestions for how to use this technique along with potential nutrition topics and dilemmas based on common misperceptions and norms. So those are just a few of the examples of the tools and resources included in this collection. And the idea is that this collection of materials is meant to help expand current nutrition programming. It is in a comprehensive package that has everything that you would need for a community nutrition program. But based on some of the gaps that we identified, these are some tools that we hope will be helpful with your work. They can be added to existing activities or used separately or together. And we encourage you to adapt them based on your own findings from formative research and the needs of your programs. All of the materials are on the CDs that you received in your packets this morning, along with a document which describes the tools and resources in more detail. The entire collection of tools will be available on our website, iycn.org, next week. And we'll send out an email to all of you to let you know when the materials are available so you can share it with your colleagues. Thank you. Sure, if anyone has any questions.
Hi, Bart Burkhalter, and my question is not about technology. But it's about grandmothers. And that was very interesting for me. And I'm wondering to what extent you've had interaction with Judy Obel and the Grandmother Project, and just talk a little bit, because I think that's a fabulous direction that you're going in.
We actually worked with Judy and the Grandmothers Project. Initially, in 2009, we had some pilot activities in the eastern province of Kenya, and Judy advised us on how we should go about doing it. And Judy also is the one who conducted the literature review on engaging grandmothers and men. So we've been working with her off and on for the past couple of years. And we're in the, hopefully about to start an evaluation of activities to engage grandmothers and men in Western Province in Kenya. And so we should have the results from that hopefully January or March of next year.